2 simple exercises to regain control after stroke. Hey my friends! Welcome back, it's Dr. Rehab here. So excited to have you with me today. Today, I've got 2 super easy exercises for you that can make a huge difference in your recovery after a stroke. And the best part? You don't need any fancy equipment, just your body, your willpower, and a little bit of space. So, let's talk a little bit about why knee mobility is such a big deal. If you're enjoying these videos, don't forget to hit like, drop a comment, and subscribe to the channel. Your support really means the world to me. After a stroke, even the simple act of standing up can feel like climbing a mountain. You need your feet flat on the ground, shoulder width apart, stable and strong. But I get it, for many of us, just getting into that position is tough at first, and that's totally okay. That's why I'm showing you these exercises. They're simple but powerful tools to help you bend your knees better, lift your legs higher, and feel more solid on your feet. I've also worked with different patients, each at a different stage in their journey. You'll see in the video, no matter where you are right now, there's always a way to start and improve. Progress might feel slow sometimes, but trust me, every little bit counts. Consistency beats perfection every single time. And remember, you are stronger than you think. Celebrate your efforts, no matter how small they seem, because you are moving forward, step by step. Now grab a chair, find a little space, take a deep breath, and let's get moving together. Let's do this. For the first exercise, start by sitting on a chair. It can have armrests. If sitting steadily is difficult for you, feel free to hold on to the armrests for extra support and to avoid unnecessary movements. You will also need a small object to act as a barrier for your foot to step over. A pillow works perfectly. Here, I used a balance pod with a height of about 8 centimeters to create a manageable obstacle for foot movement. In this part, you can see Yasna, who has weakness in her left leg. She holds onto the armrest firmly with her right hand and stabilizes her right foot solidly on the ground. Then, she attempts to lift her affected left foot over the obstacle. At first, the movement is very difficult for her. To help her succeed, we repositioned the obstacle in a way that reduced the strain, placing it where her leg needed less movement against the spasticity. This adjustment made it easier for her to lift her foot over without too much effort. As she repeats the exercise, her control improves, but the challenge remains significant, which is completely normal during early stroke recovery. In this next example, the patient is dealing with significant spasticity in his right leg. Bending the knee is much harder for him due to the increased muscle tone. He struggles to lift his foot over the obstacle, and his overall muscle weakness makes the movement even more challenging. We use the same balance pod with an 8 centimeter height, but the difficulty level is clearly much higher for him. Additionally, his affected arm also falls into a spastic pattern. To stabilize himself, he uses his non-affected hand to grab the armrest firmly. By holding the chair tight and fixing the strong leg on the ground, it's way easier to lift the weak leg than when it's tough. Despite these difficulties, he continues to attempt the movement, and even small improvements at this stage are very meaningful. And finally, You can see how he manages to complete the task successfully, a true result of persistence and hard work. We can also offer this exercise in another variation while the patient remains seated. This time, we place the obstacle directly in front of the affected foot. We ask the patient to lift the foot up, place it gently on top of the obstacle, and then bring it back down behind it. During this movement, when the foot is resting on the obstacle, both the hip and the knee are flexed. As the foot moves down behind the obstacle, hip flexion decreases slightly, while knee flexion increases. This variation challenges coordination and strength at the same time, and it's a great step toward improving functional leg control after a stroke. Step by step, strength and control return. In the second exercise, the patient sits on the bed in a long sitting position. It's best to place a stable support behind the patient's back to avoid extra strain on the lower back and to increase trunk stability. This makes the movement easier, especially for patients who have significant trunk weakness or poor hip muscle strength. Next, we place the obstacle on the bed, positioned between the patient's legs, as you can see in the video. We ask the patient to lift their leg and move it to either side of the obstacle. In this exercise, the knee stays mostly extended, and the movement is driven by hip flexion. However, some patients may use trick movements compensating by flexing the knee slightly or shifting the trunk to make the task easier. As you can see, the patient finds it challenging to lift and maintain the leg position, with some knee bending and a little trunk rotation to compensate. Progress doesn't come easy, but every bit of effort brings you closer to your goals. Try to practice this exercise twice a day, doing 15 reps each time. Your body will thank you. I know recovery can feel like a long road, but trust me, with steady practice, progress will happen. I'm so proud of my amazing, patient fighters who show up every day and give it their best. I really hope these exercises help you or someone you care about too. Stay strong, keep practicing, and remember, every little step forward counts. Thank you for watching.